Today I have with me Dr. David Puthukadan. Can you explain what cornea is actually?
As you know, the eye is a ball-like structure. How do we get vision? When we look at something, the light has to go into our eye and has to fall into the retina of our eye. Then only we get vision. So the front layer or the first layer through which light passes is called the cornea. An easier way to interpret that, it's a black portion of your eye. That black portion of your eye, what you see outside, is called the cornea. So to get vision, the light has to pass through cornea, pass through the lens, and has to fall on retina, that is a sensitive layer of the eye. Then only we'll have vision.
Is there any preventive measures you can take to
Avoid corneal blindness. I would always tell that prevention is better than cure. So you should avoid getting an injury or an infection to your eye. What we see commonly in our practice is, it's common following industrial injuries, grinding, people who are engaged in grinding. When they get a foreign body or when they get an injury to eye, they don't care it. It gets worsened, it gets secondary infected, it goes for an ulcer. Usually that's a common cause for corneal blindness, secondary to injuries or secondaries to the infection. So always you should emphasize on ocular hygiene to prevent injuries to the eye. If at all you get an injury, early reporting to an ophthalmologist would help in solving majority of the problems and avoiding a corneal blindness. And early and proper treatment would definitely help in avoiding corneal blindness.
How do you approach treating corneal blindness?
Any foreign body or dust or whatever injury which occurs to your eye, it has a normal course of healing. If it is a minor injury only, it heals by itself because our eye has its own protective mechanism. It has an antibiotic, it has a lubricant mechanism. So if there is an injury or there is any debris which is staying on your eye, stuck to your eye, that can be a foci of infection. The infective material, bacteria, all that can come and aggregate over that locus, and it can result in a secondary infection to your eye. So early treatment, if there is a foreign body or a dust which is stuck onto your eye, it should be removed. It should not be left there. If it is left over there, it will get secondarily infected and it will result in corneal blindness. So early treatment would include early removal of the foreign bodies, prompt treatment with, if there is an early infection or a minor infection which is less than 1 millimeter or so, early treatment with antibiotic will definitely help in healing of the cornea with less amount of scarring. As I told earlier, the transparency of the cornea is very important. If there is any interference with the transparency of the cornea, the vision will be lost. So early healing without scarring is our aim. That's our aim. So early treatment with antibiotic or lubricating drops will help in reducing the extent of the scar, thereby limiting the corneal blindness.
Our eyes are suffering through an infection because sometimes you just have a red eye and then it goes in a day or two.
The common signs of infection would be redness. There would be pain. You would have severe pain. There would be light intolerance. You won't be able to look at a bright light. If all these symptoms are there, if there is a discharge, if you see any whitish discoloration of your cornea, that's the black portion of your eye. If you see any white dot, and if there is redness surrounding the cornea, there are limbal arcades, limbal vessels, if there is redness around your cornea or within the eye, any redness which is persisting, points towards an infection in the eye or inflammation or infection in the eye, that warrants an ophthalmic evaluation. So if there is a permanent redness which is not disappearing, which is not vanishing overnight, and if you have pain or irritation, you should definitely consult an ophthalmologist. Even infections can progress overnight. It can get worse to the next day. So at the earliest, you have to consult an ophthalmologist.
Does any part of the treatment for corneal blindness involving surgical method or anything like that?
When you come to the treatment of corneal blindness, you can divide it into pediatric age and adult age. In a pediatric age, there is something called amblyopia. Your eye, your vision, if you don't have your vision, the development of your vision occurs till 8 years of age. If you don't have good vision in your eye till 8 years of age, that eye, there are two eyes, there is decreased vision in one eye up to 8 years of age, it will become lazy eye. If it is not corrected before 8 years of age, so it's called amblyopia. So in children, the corneal blindness treatment is very important. So if at all they have to get a treatment, they should get a treatment before 8 years of, they should get it before 8 years of age, because that's the time of development of your vision. If your vision development is not occurring properly before 8 years of age, you get something called amblyopia or lazy eye. So even if you have a pathology in your childhood, that is before your 8 years of age, and you don't correct it immediately, and you come for a correction after maybe 20 years or 30 years, even if you do a transplant surgery, your vision might not improve completely. So as far as pediatric age is concerned, it requires immediate treatment. In an adult age, okay, that can be done according to patient's comfort or patient's financial reasons or whatever. The treatment of corneal blindness is corneal transplantation. The corneal transplantation is transplantation of a donor cornea. When a patient donates a cornea, when a dead person donates a cornea, that cornea is taken, it's harvested, it's stored and transplanted to a appropriate recipient. Corneal transplantation, there are three methods. There can be divided into three methods, where you transplant the whole thickness of the cornea. You take patient's cornea, you cut it according to your size with a trephine and transplant the whole cornea. And the other methods would be lamellar surgeries. Lamellar surgeries means you don't have to transplant the whole cornea. Maybe the anterior surface of the cornea, the front surface of the patient's cornea is transplanted to a recipient. That's called DALK, deep anterior lamellar keratoplasty. If you transplant only the inner surface or the posterior surface of the cornea, it's called Descemet's membrane, DSEC, Descemet's membrane stripping endothelial keratoplasty. So grossly you can divide into total keratoplasty and lamellar keratoplasty.
After this cornea transplant, how long does it take for the vision to be restored, or how long is the recovery period?
What I usually tell my patients is that your vision, it would take at least 6 months to recover completely. If it is a gross corneal opacity patient, recently I had one patient who was a one-eyed patient. He had lost his other eye. He had undergone this transplant surgery in his one eye. He was having only counting fingers close to his face. So immediately the next day itself, patient was very happy. He was able to see all the faces and all. But for complete recovery to take, it will take at least 6 months to have. When you transplant a donor cornea to your eye, it has to get adjusted to your ocular eye surroundings. So there will be swelling of the cornea. And the swelling of the cornea will have reduced transparency. So that swelling has to come down. The cells of the donor cornea has to start functioning. So all those to settle down, it will take at least 6 months.
Do you need to undergo any specific therapy?
When you are speaking about corneal transplantation, there are two factors. You need to have a lifelong follow-up. You need to be in touch with your ophthalmologist throughout your life. The second thing is you need to have lifelong medication. One main problem with the corneal transplant, like any other transplant, your body can reject a donor cornea. Okay. It might not get accustomed to your ocular surroundings. You are transplanting a donor cornea. To get it adjusted to your body settings, it might take a little time. Even if it gets adjusted to your body settings, anytime your body can recognize that donor cornea as an outside thing. So that time you can have a rejection. So ideally we ask the patients initially, the follow-up period may be weekly. Then once you feel that cornea is okay, it's getting settled, we extend it to 1 month. Maybe once it's settled, once you know the patient has a good vision, patient has to come at least once in 6 months for a follow-up. We usually ask the patients to continue the medication for 1 year, but depending on the rejection or failure, the patient might require to use medication for a longer time. See, corneal transplantation, I told, vision is dependent on the functioning of all layers of your eye. If your retina, I told initially that the light has to pass into your eye and has to fall on your retina to have a proper vision. If your retina is not functioning properly, if you have any other illness, if there is a bleeding within eye, a transplant won't solve your problem. So you have to have a functioning retina or functioning other layers of your eye to have a successful transplant. If you feel there is a retinal detachment or a gross retinal problem, we won't advise surgery for a patient. So we usually assess the potential for recovery of vision, then advise surgery for the patient. Otherwise, if there is a gross infection in your eye, there is a source of infection, if there are other complications, other associated inflammation, usually we treat those causes first, then advise surgery for the transplantation.
Talking about blindness, what other types of blindness are there?
Blindness can be due to all pathology. Any pathologies or illnesses affecting your eye can cause blindness. If there is a retinal problem, there can be retinal detachment. If there is a lens-related problem, that's called cataract. If there is loss of transparency of your lens of your eye, I told initially about the transparency of the cornea. If there is a loss of transparency of your lens of your eye, it's called cataract. The light rays can't pass into your eyes and fall on your retina. So your vision will be lost, which can be treated with a IOL or a cataract surgery. A cataract surgery can cure such sort of vision. If you have a retinal problem, retinal surgeries or medications or intravitreal injections might be required to treat that problem.
Doctor, I heard something about this corneal ulcer. What exactly is that?
Corneal ulcer is an infection affecting your eye. The microbes, bacteria, fungus or virus can penetrate your cornea. It can multiply and infect the whole of your cornea. If there is an infection of your cornea, it's called corneal ulcer. The treatment modalities of corneal ulcer would be, initially, you go for a diagnostic. You take a bit from the cornea and culture it. You grow it on a medium and identify the organism which is affecting your cornea. If you get an organism, you can get the sensitivity also, which are medications are sensitive to the specific type of organism, and you treat accordingly. Most of the ulcers heal with a minor scar. If there is an extensive ulcer and if you can't treat it, there is a treatment. In those cases also, the patient can undergo a transplant surgery. That is called a therapeutic keratoplasty to control the infection. So in those cases also, you can undergo a transplant to control the infection and to retain your eye.
Can you say something about eye donation in general?
Eye donation, eye donation usually occurs after the death. After the death, any person can donate his eyes. There are few criteria. The patient should not harbor any infections like HIV, HPS, human hepatitis, or HCV or syphilis. If patient is harvesting any such infection, those infections can be transmitted to the recipient also. So patient should not be having all this infection to donate. Usually any patients between 2 to 75 years are eligible for donation. Only thing is that the relatives should inform the corresponding eye bank within 6 hours of the death. Then only donation or harvesting can take place. Earlier I had mentioned about lamellar surgeries.
Yes.
So if you can transplant if you get one donor cornea, you can transplant the anterior surface, the posterior surface, and there is something called limbal stem cells, which is the cause for the skin growing of the cornea. The cornea has a covering. Okay. If a person has deficiency of limbal stem cell, those cells can also be transplanted to a different patient. Along with that, you can transplant the anterior surface, the posterior surface also. So 3 patients can get vision.
So basically, one single cornea has a potential to save
3 eyes.
Do you have a lot of donors coming in? Or?
We have a lot of donations. Our eye bank is one of the oldest or the first eye bank in the private sector in Kerala. So we have a good rapport with the community and with the nearby hospitals. So we have workers in our community or supporters in our community who intimate at the time of our death. In that way, we have a lot of cornea. Whatever surplus cornea we get, it never gets wasted. We are supplying to cornea. There are people who are surgeons who require cornea outside Kerala also. We are supplying to donors even outside Kerala also. Recently, we had a Nigerian patient who came from Nigeria all the way to get a transplant done over here successfully.
Would you like to say anything to the viewers regarding eye care?
As I told initially, prevention is always better than cure. So it is when there are industrial workers or people working in farm or periphery, they always should avoid getting an injury to your eye. So workers or people involved in grinding can use protective eyewears or a goggles to prevent injury, or when you are swimming also, use protective eyewears to prevent any organism or injury occurring to your eye. If at all you face or encounter an injury, prompt and early treatment will help in restoring your vision back to normal. If at all you go for a scarring or a decreased vision due to corneal blindness, there are treatment modalities available. Usually, vitamin A deficiency is commonly associated with decreased vision and scarring, which is more common in children. Green leafy vegetables and carrot or nutrition which contains vitamin A will definitely help in maintaining the vision or preventing corneal blindness to a greater extent. Okay. I will stress on green leafy vegetables more. That will, rather than non-veg diet, a green leafy vegetable diet will help in preventing vitamin A deficiency or other nutritional problems.
And that was Dr. David Puthukadan. So until next time, that's me, Angel, signing off.